most important, I think, or the first section is know the symptoms. In our report, we list all the symptoms for COVID-19. These symptoms will, this list will be sent to parents. We'll have it on our website, and we're asking our parents if their child exhibits any of these symptoms, they keep their child home, go to their child's pediatrician to see if these symptoms, and can we just, I got them in front of me, they're the fever, cough, shortness of breath, all the ones that we have them on our doors if you get asked when you go to your dentist or doctor's office. Also, the temperature issue. I know we haven't settled on it, but we're proposing that parents use the Pickup Patrol app, and parents can take their child's temperature at home, input the data, and it goes immediately to their child's nurse's school, or to the school. The nurse then will have a list of all the students that literally it's a green dot. They're okay. If somebody has a fever and they're in school, or if they're missed, the nurse will then call those students down at the very beginning of the day to screen them. So that's how we plan on screening students for their temperature. The next item is the screening. Again, for this to work, we have to rely very heavily on our parents' support in this with the screening. Our staff will also be screened according to Dr. Chan and the DOE. We have to, from Dr. Chan, excuse me, not the DOE, we have to screen every employee before they come into work. Where students, we've been given direction that parents can do all those things at home and then send us the data. We actually have to take every staff member's temperature before they come in the building. We have to ask them the same set of questions that parents will be given before they can come into the building. And the principals have been working on a schedule for a window when teachers can arrive, what the earliest they can arrive at, and what's the cutoff date to get their temperature done. For scenarios, we're going to be talking about, we talked briefly about the symptoms. We're going to talk about what happens if someone comes in contact with a COVID case. We'll also, in the report, we've addressed what happens if a child or an adult, because these protocols go for both employees and for students. What do we do if we have a suspected case? We also address the issue of travel. If you travel outside the New England states, you have to quarantine for 14 days before you can come back in. That was a relatively new guidance that we got, although Dr. Chan did loosen it up a little for parents taking their children to college. If they drive themselves, wear masks, and basically stay as contained as possible, they can come back, and that 14-day travel date is waived. So what I will do is I will turn it to, I just want to make sure I touched on everything, because I know you have the report, so I don't want to go into everything, but in the report that we sent out, you notice there's this document here, or these pages. These are our scenarios. This is what we're going to live by. These scenarios were provided to us by the state of New Hampshire, what the response is, and the protocols we have to follow. And it's easy to follow, and we can answer any questions after we're done with that. So I'm going to have Marge just kind of touch base on this slide.
So the reason that we put this chart in, we thought it was an easy graphic for parents. On the left-hand side, we have all of the symptoms as identified by the Department of Public Health and the CDC. And on the right-hand side is, what do I do at home? So the top part is for parents, what do I do at home? So as Bill said, in the morning, I take the temperature, 100.4 or less, you go to school. If it's 100.4 or more, you stay home. And then you go through those symptoms. Do you have a symptom? You stay home. Have you been in contact with someone who has been suspected or confirmed? We stay home. Have we traveled outside of New England except for the educational employees who are considered essential for starting school, you stay home. So that's the top part. The bottom part, and that's what Bill was talking about with all these scenarios. And these scenarios were developed by school nurses with the Department of Public Health. So on the bottom, it talks about symptoms of a child when you're at school. So basically it says what we'll do, we have the symptoms up above on the left, we notice that at school, we call the parent. We suggest that parent call your child's doctor right away, and the doctor will decide if the child needs to be tested or what they added recently. The healthcare provider deems testing is unnecessary because that was a symptom of an underlying condition that the child has. We don't make that decision, the doctor makes that decision. So you can come back to school if you either have a negative test or that note from the doctor. On the right-hand side is, and this goes for our staff as well. It's not for us as administrators and our staff, we do that. If somebody, on the right-hand side, it talks about a positive test. So if I have a positive test, I can return to work or to school after 10 days have passed since my first symptom, and I have not had a fever for 24 hours without taking a fever-reducing medication, and my symptoms have improved. So you need to have all three of those factors to go back to school or to work. Now these are all in these protocols, and some of these protocols have changed since July 27th. We are getting new guidance either this week or the beginning of next week, and a new toolkit for schools, so some of this will change. I will say that the Department of Public Health has been very responsive to school districts. We can call them at any time on our meetings. Throughout the meeting, nurses or school leaders can ask questions, and there are phone numbers that we can call. A school nurse can call during the day if they are having a question about how to interpret some of these symptoms. So I think we feel very good with the kind of support that we are getting from the Department of Public Health. Sure.
And
Just-
I just want to touch on this
Sure.
before I forget, because I know it came up, Kara asked it this afternoon of me, and it's a good question. If a child, the question is what happens if the child doesn't get the doctor's note, has COVID and has to be out for the 10 days. We would then assign that child to a distance learning module, depending on what grade they're in. So we're just not going to have the child sit out for 10 days. However, understanding that it may take a day or two to get your doctor's note back in to the school, we're going to treat it like we would any other absence. You know, if it's a short term, 1 or 2 days, we would follow our protocols that we had in place prior to this year. Also, as far as one of the questions that we didn't touch on, that we're going to ask our employees, and parents need to go over this with their children. They know it. They don't have to ask it. Have you had close contact with someone who's suspected or confirmed to have a COVID-19 in the prior 14 days? That's going to be one of the questions that everyone gets asked over and over again. And if they say yes, then they're going to have to get excluded, and follow these protocols here. So I just wanted to touch base on that. Karen, do you have did I?
I just wanted to clarify that it's 10 calendar days.
Yes, it's 10 calendar
not
days.
10 school.
In health world, they don't think in school calendar. It's 10 calendar days. And the next slide is, what do we do if we have a case? If we have a reported confirmed case, depending on how we are notified, we believe we would be notified by the Department of Health first, although a parent may call us first, it depends which way. Regardless, if the parent informs us of this, we are going to contact the Department of Health immediately for guidance, and at that point, they take over the investigation. We will obviously assist in any way they ask of us. My understanding from the training, the PowerPoints that I've read, is that they're going to try to do contact tracing, find out where that person was or where the child was, who they came in contact with, et cetera. Something that I've added for the board's consideration, guidance that we receive from the state. If a child or an adult has a confirmed case, the state guidance is evacuate the room, clean the room, then bring everybody back the next day. I find that unacceptable. I don't think that goes far enough. So we reverted to the original CDC guidance. If there's a reported case, originally the CDC said schools should shut down for an appropriate disinfecting process. They say 2 to 5 days. Dean, we've talked a couple days for any of the 3 schools for the most part. Yeah. But I want to put that in there, and I think we need to follow that because we have to do everything we can to make sure it's safe for people to come back. I just don't know where they were coming from, they being the Department of Health. As Marge said, they've been very helpful in many ways. I'm not sure where that came from or why, but since this is New Hampshire and it's local control, I feel we can have more stringent regulations than what the state says. Another question that comes up quite a bit, and it's a good question, and I think we touched on it at the last meeting, is what are we going to be looking at indicators to close the school down? Obviously, if we get a confirmed case, we're going to shut it down for a short period of time, assuming it's a single case, it's isolated. But if we get multiple cases all at once, we're going to contact the Department of Health for guidance on that, see what they tell us. It might be we just disinfect everything and reopen. It's really going to depend on the number of reported cases that we get at any one time. A couple of things. We talked about the positive rate. The number is 5%, and I think we've talked about this before. If a community or a state has a 5% number of cases that have COVID, that's the threshold that you look at. And again, I think we talked about at the last meeting in New Hampshire was at about 2.3%, well below that 5% figure. And the guidance, or I want to say, because we read a lot, I don't want to reference the source, but it's 5 consecutive days of 5% or higher is the threshold. So if we're looking at either within the community of Hooksett, surrounding districts, also the state, Massachusetts plays a big role in what we do because of location, maybe more so than Mass because a lot of more people work down in Massachusetts. We're going to be looking at all that. We're also going to be looking at our own attendance rates. With those protocols that we just touched on, will we have situations where we just have so many kids out we can't stay open? Quite possible. It might be short term, might be, for an indefinite amount of time. There's no hard and fast rules that we can go by, other than that we have to monitor it. And also it goes for our staff. I keep coming back to that. It's just not our students, it's our staff. If they're sick and they're out, that could hinder our ability to open the doors for our school. And if we have a reported case, we will notify parents, we will notify staff throughout the district. We'll say we had a reported case at such, Cawley, since we're here at Cawley, and we'll let everybody know we're taking the appropriate steps. We're not going to identify who it is, if it's a student or an employee. We will say, we might, and I got to get this checked with our attorneys, we might be able to say a student or an employee, but I know we can't go beyond that. But it's important that we let everybody know what's going on. So that's how we're going to respond. Some people say, well, you're going to let us know, and kind of gave them an incredulous look. I said, yeah, we're going to, of course we are. But that question has come up both on different 3 districts' websites, but also emails that some of you may have received or I received. So that's my portion. I'm going to turn it over to Matt to take it home.
Okay, health and safety. Last week we were at Fisher Cat Stadium, so a little bit different, a little smaller venue. I got a little scared seeing myself up there. Whoa.
Having on the high coat if you want to hear it.
Absolutely, could be right. Could be the time. So health and safety, obviously the board made the decision, based on our recommendation regarding face coverings, requiring face coverings for all staff, and requiring all face coverings for students in grades 2 to 8. It's encouraged for students in pre-K through 1. Is that correct, Marge, pre-K? Yeah, pre-K too. Okay, required on the bus, and like as Mr. Rearick said, we're not going to turn away a student who doesn't have a mask, we're just going to give them that mask. And face covering breaks will be incorporated into each of our schedules at each of our schools. That will maintain that 6-foot distancing when we do have those mask breaks.
Teachers will also have the flexibility we'll have set times, but if a teacher needs, maybe their time is 10 a.m. and they just notice whether themselves or their students, they need that break, we're going to be able to allow them to do that. Having to have sat through, where are we, Candia for 3 hours in the heat? So we certainly understand, having experienced it, how difficult it is to keep these on for an extended period of time as an adult, never mind a child. And again, with the masks, this is going to be an ongoing reminder, and we're going to have to be working with our students and our staff that, what are the guidelines. So it's not going to be just nice and smooth. It's going to be, we're all going to be learning, we're all going to be adapting, and we have to understand that when we move forward. It's just not going to be, ice cream and unicorns and rainbows.
Can I ask a question?
Yep.
So in this document, it says at teacher discretion. Mask breaks would be given at teacher discretion, and earlier it was scheduled. So just to confirm, they'll be both
They'll
scheduled?
be both.
Yes.
And then if later in the day, the teacher wants to take another one,
Yeah,
so
we're not.
that 5 classes aren't going
Yeah,
out at the same time?
we want the flexibility. We want to build them in. to
Would
say-
they call the office and just say, hey, we want to go take a break, is now a good
I mean, I can speak to Colley. A Colley, they're going to be built in within their time, like the teams manage their own schedules. They'll be built in, but obviously teachers have that discretion. Hey, guys, we need a mask break. Let's go out. And yeah, they'll call the office and let us know that we're going outside. The other thing.
And that's if they're not outside already. Again,
Right.
one of our goals is to try to get as many classes outside as possible, both, at all 3 schools. That we haven't gotten really that far in the planning, but that's our goal for that to take place.
So another thing with the masks that what we're doing here is that's going to be part of our professional development. The nurse and Mr. Largy, he got chosen for this, are going to be doing a video on the proper ways to wear a mask, dispose of a mask. We're going to share that with students, staff, and we'll probably put that up on our website.
And we
too.
also have to clarify, it's a good question from
Yeah.
our parent. We have to clarify the type of face covering, excuse me, that's going to be allowed. We want to be clear about that.
Correct. So each room, we've talked about social distancing right from the get-go. Each room will, the classroom will have the 3 foot of social distancing. The custodians have begun to set up the desk in classrooms, and they're going to put the desk with the chairs so that there's actually markers on the floor, not markers, but maybe tape, little things so that the custodians know, the students know, the teachers know. Obviously, being in the classroom, sometimes it gets a little fidgety, but you can just move them back to those spaces. Outdoor learning will take place as appropriate. We've designated areas for each of the teams outside that they can go and certainly do that. We've talked about cohorts too. Cohorts is keeping a consistent group of students together when feasible. In those cohorts, teachers will travel to classrooms and students will remain in that classroom when feasible. Obviously, there are certain students that will have to come out for certain things. Again, we go back to desk and the 3 feet. Students in those classrooms will all be facing forward in the same direction, and they'll be in the same assigned seat every day. So once you get your assigned seat, that's your desk for the day. And it's not like usual when you come in, like, we're doing a different activity, let's move the classroom around, let's try this. Students, you'll walk in and that will be your seat every day.
So before we leave this slide, just to be clear on the face covering, we're following the guidance from the American Academy
Yes.
of Pediatrics, and when they suggested that we could go back to school with 3-foot distancing, which allowed us to get more children in school, provide that opportunity, it was with a face covering.
And also, we're going to get to it a little later, but we have schedules for when children will be expected to wash their hands, and we'll get to that a little bit later, but that's an important part of our protocols.
So with the cleaning and sanitizing, we're following the CDC guidelines for disinfecting the building, and certainly the disinfectants for SARS-CoV-19, CoV-2. They're all EPA approved. Mr. Farmer's done an in-depth job of looking at that and talking to his vendors. Daily cleaning, each principal recently in the last week has created a daily cleaning schedule for when the students walk into the building to when the students they leave. For example, for Colley, they walk in, Team Yale walks into their, I'll use an 8th grade team. 8th grade team walks in, they go up their stairwell, a Team Harvard stairwell, and they're all touching the banister walking in. Immediately after that, the custodians at Colley and the other schools too will go in and they'll do a quick disinfectant of that. And there's a setup pattern for around the school that we've identified. This is where they come in. Okay, students are here. Now the custodians will go in and do all the door handles, the push bars, the light switches. So we've identified those areas and those touch points throughout a typical school day. The cleaning, obviously we talked about the electrostatic sprayer. That will certainly be used for disinfecting. And hand sanitizing will be a part of our day. When students and staff enter the building, they will be required to sanitize their hands. When they start a new class here at Colley, that's certainly a time that, they're going to sanitize their hands. They leave an area, they come back, they're going to sanitize before and sanitize after. Again, those hand sanitizing I want to say strategies or methods, they're certainly going to be shared with our staff, with our students, and certainly with our families, certainly so that we're consistently modeling that throughout the day and working with our students and staff on that.
Also, on the hand sanitizers, originally we thought we'd be able to put them outside the classrooms or outside the lavatories, also right out here in the main lobby or the other entryways. We've been informed by the fire department that the alcohol-based Perel, or whatever that liquid is called, is a potential fire hazard, and we cannot have them in the hallways. We can have them in the classrooms or inside as you walk into the lavatory up on the wall, but not outside. So again, as the information changes, we have to adapt our protocols, and Dean's been in contact with the Hooksett Fire Department.
And part of those protocols too, there are, just anticipating this question, there will be hand sanitizing stations in each classroom, and that's part of the daily cleaning and updating of making sure that those are filled. So when students walk in the next day and staff walk in, that they're ready to go again.
Yeah, it'd be a fire code violation. Even if the insurance haven't gone through, Rhode Island has had the most stringent fire code standards in the country after the Station nightclub fire, and we would go to our carrier and they'd say, no, you're good, but they're the guys that control the building, so you really got to follow what they tell us.
Matt, is there a way, I've been asked a lot, with people with food allergies, I know we have the hand sanitizers, but will there be a chance or way, and I know at the lower schools there's sinks in every classroom, so there is, but I wasn't sure on this building, that students can actually wash their hands with soap and water before and after eating to cut down the spread of, let's say, peanut butter.
So and funny, I anticipated that one. So yes, I believe in the other schools, there's sinks in all the classrooms. There are sinks at Colley here too. So there is warm to hot water. So students will have that opportunity to, if they don't use the hand sanitizer, they can certainly do a thorough washing of the Happy Birthday song, washing their hands.
I just wanted to check with Dan to see if the live stream was up. It is? Okay, thank you.
The other thing too that I want
Can you exhibit the happy birthday song and wash your hand?
It's no haiku.
No?
Thank you.
No, I could.
If that's what the board would like me to do, I'd be happy to. So, the other thing too, Dean has created a nightly checklist that he has shared that will be completed for each room that's being used. When the lead custodian comes in the next day, and Dean, they will check each of those checklists. If something's not done, they'll clean that immediately, refill, or do something like whatever needs to be that wasn't.
What we did, and this is really for discussion after this, but I think it's a good segue. I asked Dean to do a time study for all the schools. In other words, how long does it take to clean a classroom, to do all the things we say we're going to do. He did it to the minute, and he did it by school. And for us to meet these guidelines, we're going to need to hire additional staff. There's no way he can do it, and I'll be happy to share them with the board. We just didn't get them out. We just got them before. We didn't have a chance to get them out. But when you see it's to the minute, and in order to do this, we're going to have to hire at least 3, if not 4, additional staff members. And because there's even if we can put the money together, well, not if we can, we're going to have to. We may have to use an outside agency when school starts before we can bring people online. But we had, this was an important piece of our puzzle, and in order to do it, it's going to cost us an additional expense on that, along with a couple other items I need to address.
So, arrival and dismissal. It's scripted pre-pandemic, but it's even now more scripted with traffic patterns and students and parents arriving. The key to this is we don't want that log jam where students are just getting out of the car and they're congregating together. So each school is developed a traffic pattern. The traffic patterns at Underhill and Memorial, students will get, I would say, like a place card or a card that, a placard or something that has their student's name on it, a parent's name on it. There are set times. A through L will drop off and pick up at certain times, and M through Z will drop off and pick up at certain times, beginning of the school day and after the school day. Both schools know that sometimes that may not be conducive to a parent's schedule, and they'll certainly be flexible with that. But at least it gives a framework to how to set this up. So basically, they drive up. Before they get to the entrance, there's a staff member that sees that, oh, here comes Mr. Denbo and his children. And so Mr. Denbo comes up, he gets out of the, Zach gets out of the car, and he goes into the cafeteria. There are teachers there to greet them all the way down the hall, and they go all the way down to the hall to their classroom. That would be similar to Memorial. The afternoon pattern is also the same way, where students would be called down to the cafeteria, all the way down the hall, set guideline, and again, while they're not when they're parked, okay, but as they're driving in, they see, oh, here comes Mr. Denbo in a different vehicle today, but here comes Mr. Denbo, and we'll, so Zach, please get Zach Denbo ready to go.
My son's been in 8th grade 8 years, that's pretty cool.
Okay. Well, no, that was actually the
You're proud
elementary schools.
dad.
So the same thing with buses, and I'll use Colley for an example, but I'll certainly with the other buses, where I'll go to the parent drop off and pick up for Colley. So same thing with Colley, they'll drop off, they'll walk into the building from the 7 to 7:40 time. We have 3 separate different areas where the 8th grade will go, and cohort by team, the 7th grade go, and the 6th grade will go, and they'll cohort by teams. At 7 a.m., 7:40, when we call students down, we're going to call them down by homerooms, homerooms and teams. And again, there'll be teachers walking down the, not walking down the hall, will be in the hallways to make sure students are maintaining social distancing with their required mask on. As I explained, the buses will go through, they'll only load at one or two at a time. Certainly in the, at Colley, when the 11 buses pull up in the past, have you ever seen it? Marge laughs about it. It's about 20 seconds. The kids get off the bus, get in school, and you look and go, where'd they go? So now, what we're going to do here at Colley is I'm going to go out and we're going to dismiss each bus by, from front to back. We have designated at Colley, instead of the 6th graders all walking into one entrance, Team Yale will walk into an entrance, Team Princeton will walk into an entrance, and Cornell Brown will walk into the 7th grade entrance, and then the 8th graders will have an entrance too. So it's very scripted. It's really trying to keep those cohorts together, and rather than having a lot of kids cross paths when they do that. So that's certainly, those are the plans that we put in place. At the end of the day at Colley, when students dismissed for parent pickup, they're going to go down, called by homeroom, and when I was explaining to Mr. Largy kind of the plan, there'll be, I hate the word corral, but they'll be in a section by team where there'll be 3 feet to 6 foot social distancing with their mask on. Parents will pull up and we'll call the student.
Can I ask a question? And yeah, I just wanted to clarify, because I know parents are listening and probably have this in hand. So it'll be A through M. I know you said L. Is it as that's in the guidance that went
A
out?
through, it's whatever in there.
These are
Okay.
So
Lindsay.
folks, follow this.
Okay,
Okay.
so what is it, Lindsay?
A through
A through M
A through M
and N through Z.
and N to Z.
Yes.
A to M, N to Z.
And then I also have a question, especially for the little ones. Do we anticipate this creating really late arrivals at home?
We
For
are
the
meeting
younger
with the
ones?
bus company tomorrow morning at 9 a.m., right here. And the bus company's been given our proposed schedules and what we want to do, and we will be able to have an answer by the end of tomorrow, we hope, from them. But we're not anticipating it because we're using the same number of buses. Times are pretty similar to what we're used to. So we're not anticipating any, but with that said, I don't want to say it until we've got a confirmation from the bus company.
Thank you.
I was on the same thought that if they're coming off the bus slower than in the past, is it going to affect pickup times for the next run?
So Colley, no, because traditionally there has been a time, a gap of time where actually the school buses kind of hang out up here, or they'll hang out in different places to get ready for their next run. So the Colley run will not affect, the morning run will not affect that. Obviously, the afternoon run, that always, you know.
They always start on time for dismissal at your lead school. If you have a high school always leaves on time. Middle school here at Colley, they'll leave on time. As, you know, we do, especially going up and back and forth on Route 3, that kabuki dance is always a challenge, but it's possible that, and again, we'll learn as we go. So if we say, for example, children from Memorial will get, you know, our K-5s will get home at starting at 3:40. We might find out, well, it's not 3:40, it's 3:50. You know, we'll just have to be flexible on that. Also on the buses, just another question that comes up quite a bit. After all the bus runs, whether it's the kindergarten, AM, PM runs, whether it's after Pinkerton, before the buses get put back into use, they're going to be disinfected here at Colley using our hydrostatic sprayers, because otherwise they'd have to go back to the bus station, and all the buses that they service, it will be like a giant car wash from the way they described it to us. So we have the space, and it will be faster for them to be disinfected here before we put them back up and send them back out.
Is that our custodial staff that would do that, or is the bus
I'll
company
ask
sending
Dean,
someone?
have we figured that part of it out
We
yet?
have not spoken about that
will have to be determined. But they will be coming here for that. That will be part of tomorrow's discussion.
Phil, can I jump in one more time? So then, anybody who's wondering too, for Pinkerton or Londonderry, they should refer to the high schools? for
Yes,
their-
whatever their schedules are,
Okay.
because the state did give us gave us a lot of latitude on the buses. I know Pinkerton's doing a hybrid model. I'm not sure what Londonderry's doing, but parents with high school students really they're gonna need to follow what's going on. But it won't impact, what we're doing won't impact them, whatever that may be.
So recess K through 5, students, which is great, will have the opportunity to participate in recess daily. The outdoor space is going to be developed into quadrants. So it's a big quadrant. Students, they'll have games led by their teachers, the physical education teachers, and I think at each school they're going to be developing, certainly in giving guidance on some of the games that students will be playing during that time. Obviously, they're going to follow proper hand hygiene practices before and after recess. Those quadrants will rotate, and like I said, teachers will assist those students in those activities. So food service, again, you guys know I speak very highly of Cindy Nussbaum. She's really done a great job in the spring, and with this, students are going to be eating their lunches in their classrooms. Students will be able to order their school lunches like in homeroom. They're going to order the lunches in homeroom. They'll be provided different options. In addition, students will order their breakfast for the next day. There'll be tables outside of each room. Food service personnel will deliver those meals. Any student who has a food allergy, if they can eat in the classroom with that food allergy, their meal will be clearly labeled, so they'll be able to get their meal that obviously is safe for that student. Some students may have an alternative location, just kind of like we have the peanut table during a regular school year. They'll have a place certainly that that they can eat that's safe for them. So students, again, will have those choices. If a student misses homeroom for some reason, they'll be able to order their lunch when they walk in the door from the main office. And as you know, the philosophy here is everyone eats. We're never going to let a child go without that. Obviously, students wash their hands. They're not going to be sharing utensils or items. We're going to strongly encourage students don't trade, the Twinkies for the ring dings and things like that. So,
Who would make that trade?
what? Who would make
Who
that
would make
trade?
that trade?
Oh, you never know.
Show them to me.
Right. So,
Show them for their ring ding.
and students are still able to bring in their own lunch if they want to. Meals for remote learning students will also be made available at one central pickup.
Just quick question, follow-up. Jillian asked about allergies before. I'm wondering about hand washing after meals, not only for allergens off hands, but I got sticky jelly in my hands and I'm sticking all over the place. I think after is good too.
Yes, students are going to wash their hands.
It says before in the slide, so just.
Right, yeah, so before and after, that's.
And after, excellent.
Yeah, so it's always going to be a
And
before,
now-
after, yeah.
And for college students, Dean's working on finding a solution that we can use to clean the desks with. We found out that we cannot have students use Clorox wipes. Dean, can you explain that,
Yeah, absolutely.
please? Dean's wearing an inappropriate face mask. That will be banned shortly.
You can see my sad face, sorry about that. Yeah, so I was speaking to our Central Paper representative, and I'm sure we can all agree unequivocally we don't want students using or touching chemicals. So we're trying to find a safe solution that they can use to do before and after lunch cleanup. I am speaking to them to get some sort of soap product, so it's more of a cleaning. It's not a disinfecting, but it's something to clean the surface that they're in.
This is
Again-
only for Colley.
Yeah, and this is with Colley. To expand a little bit further in the other two schools, anytime that a room is open for more than 20 minutes, we plan on going in and wiping everything down and disinfecting. That is probably on our slide somewhere. I just want to throw that out there as well.
And for the littles, for K-5, if they have after lunch and they go out, our plan is to have Dean and his team go in, not Dean, but his folks go in and clean everything down, and then when the kids come back, the surface where they were eating will be cleaned. So anything else? Anything else?
You got it?
Thanks, Dean.
So those were the protocols. I don't know if you want to do anything about that. Because the next part is what does in-person and remote learning look like?
Can I ask one clarifying question before we move on? Okay, so I know we talked about masks, face coverings, but I just need to clarify a little bit more. So I think in the original motion we made a few weeks back, we said face coverings, which would be something like what Dean has. So if we're saying masks around the ears, we maybe need to change that, if that's the recommendation, but I don't think that's, I think in the guidance, it says face coverings. So if
I
we're,
think,
if
right,
we're
that-
changing that, we have to be really clear. And I think I'm just asking for someone also to clarify at what point a shield would be acceptable for a child who can't wear a mask.
Yeah, a shield would be. If a child has, again, we've talked about this, asthma, or whatever, for whatever reason, they cannot wear one, and if they can wear a shield, we'll take the shield over not having anything at all. But it's recommended, obviously, to wear the mask. But if for whatever reason a child can't, we'll make those exceptions.
So if there's a medical reason and they have a doctor's note,
Yep.
they can wear a mask if they're grade 2 or above. Under grade 2, they could
Right.
wear one if they chose to.
Right.
Because they're encouraged to, but it's not required.
Right, because that's the American Academy of Pediatrics guidelines that we're going by.
Okay. And I just think we have to decide tonight how we're clarifying the mask, because that's going to affect, I think, how people, what some people may.
And
choose
again,
to
I
do.
think when we made that motion, we didn't have that information.
Right.
You know, it was, oh,
Right.
okay, a face covering, and now it's, you know, the information we received has changed.
From New Hampshire Department of Health, or
Oh, I want to say that was CDC.
I think that
I
was
want to think that was
The
a
most
national, I think it was
recent?
CDC.
Okay.
It wasn't from New Hampshire. But it's hard, you know, when you hear that from the CDC, you know, it's hard to say, oh, we're not going to listen to you, you know, or follow that.
Yeah, I had a few items I was waiting to the end because a lot of them got answered. I agree with Kara's point, though. I think we need to clarify the masks. There are some fascinating articles about virus size. You know, we're talking 2 micrometers, and then, you know, this versus an N95 versus what Dean's wearing versus whatever. And so you made a really good point last meeting about the risk spectrum. It's not just, you know, 5'11" level distancing, you're going to die. 6'1", you're okay. It's a spectrum, and I think we need to look at masks that way. And you know, I think given some comments that we've had in the surveys and tonight, I think we should discuss that. I think coverings was really the appropriate call there. I also want to talk. So my biggest thing missing from all this is temperature checks, and I know there's a discussion about logistical challenges or who can do it, but any medical facility you go to, any business, you're doing the 3-second or 1-second check with one of these. Green, I'm good. I mean, I'm just surprised we're talking about masks and we're talking about all these things and we don't have temperature checks involved. I'd like to follow up on that.
We've had conversations with, as you know, we were in fact bargaining with the union. They made it clear not only at the reentry level meetings, but also that they don't believe they have the time in their day to do that. And they're quite clear on that. Secondly, the second issue is that we are limiting during the day, especially visitors into the building. We're saying we don't want people to come in. So you can't say, well, then we'll bring volunteers in to do that sort of thing. When we're saying limiting access to the building. So it's contradictory to what we're looking at. I think if we do it in the morning, and again, if we have more personnel, I'd say fine. I'm already looking at, you know, 3 to 4 custodians that we're gonna figure out where the money's gonna come from. I also think we need at least one LNA in the building to help the nurses. Because with these symptoms that everyone's gonna be aware of, the nurse is gonna be a lot busier, it's safe to say, than normal. And when you see all these articles, when you see all these stories on the news or in the newspaper, they always say school nurse, like we can clone them. And we only have one in every building. And 1 to 400 might be a good ratio, or 1 to 500 in normal times. It's not under these times. So it's is that something, we can do what the board wants. I just think we're going down a path as far as the teachers where it's not gonna be an easy settle on.
So,
Go ahead.
I've been waiting a little bit here. I agree with Wayne on that, and as far as not having the time, when you have kids sitting down at lunch, it takes all of a second. A teacher can walk around and do 17 kids in, let's give it 25 seconds. So I disagree with that. I mean, we all go to stores, they have people now standing there with mask coverings and thermometers, testing you as you walk in. Those are employees that are not trained. It's using a thermometer. And to actually have them say that they're basically refusing to do that, I have a problem with.
Well, they haven't said they refused. They've expressed not wanting to have to do it. I think that there's a difference there.
Well, there's a lot of things that we don't want to do, like
And
wear
in
masks.
right.
And I'm not going to agree with
In
that.
private business, they don't have unions, they don't have collective bargaining agreements, and that would be considered a change in their condition, and that it's something we'd have to negotiate with them on.
Yeah, I'm willing to take that
Yeah.
chance.
Okay. Also, just a reminder, if you guys could speak into your mics, I guess folks are having a hard time hearing us, so. So I was quickly trying to find, because I didn't see that there had been a change in the CDC's guidance on masks. So they do keep referring to, and it did change on the 11th, cloth masks or face coverings. So I'm just wondering, sorry to pick on you, Dean, if that is a cloth mask or face covering, or the ones that go over the, people wear around their neck, but then they pull up over their nose, is cloth, how that is any different. I know some of that, what's that material that I'm thinking of? Like the fishermen wear, and those have been shown not to, what's that material? I don't know, nylon, whatever it is, that doesn't work, but, so I just think we need to make it as feasible as possible because, that's what would be safer. And then since we mentioned temperatures, I would, I know I've said it before, but I support what we've written here, or the guidance from the district. I am not sold that a surface temperature really shows us somebody's illness, and multiple times a day doesn't seem to make a difference either. So I don't want us to get too caught up in, the number of times and all of that. I think a lot of it has to do with, if a child is sick and you have a fever, they need to stay home. If a child develops a fever, we all know that a kid, when they start to look sick, they look sick. And if they are sent to the nurse and then have a fever, they should go home. I mean, you have to keep in mind that prior to COVID, if you called the doctor's office, they wouldn't even see you or your child if the temperature wasn't 101. So now we're lowering the threshold already, so
There's people queued. I'd love to follow up, though. Go ahead. Yep. I appreciate your point. I think we've got a list of symptoms, and temperature is a symptom. So to say it's a symptom that can get my kid disqualified from coming to school for 10 days, but then say it's not useful, I think is contradictory. I'm concerned about the symptoms, and again, I think there's a risk spectrum here because a child or adult with a temperature that to me is a more important symptom than the kid with an allergy diagnosis who has, sniffling and sneezing. So my concern about the list that we see is that it's just, here's a blast of things that can get you sent home, and can I preempt? I've got a child with a allergy diagnosis, so can sniffles not send him home for a doctor visit? So
All those,
Yeah.
if a child, if they have allergies or whatever, they're excluded. They wouldn't be sent home. That information should be in the nurse's office. So if any of those conditions are, it's new conditions. In other words, if a child, I use coughing because that's the most obvious one. I don't know how you would already have it, but if it's a new cough, the parent says, no, he hasn't been coughing, or he doesn't cough normally, then that would be, you need to go home, take your child home. But if you have allergies, I have allergies, I'm always sniffling, I sneeze sometimes, that doesn't, it's just my allergies. I don't send myself home. So if it's part of the child, known condition, they're not gonna be asked to go home. It's just, that's the guidance that we have. And again, we were surprised we were surprised more than anyone when we found out it's a symptom, not like 3 out of 5 symptoms that we listed. It's a symptom. And again, as far as that goes, we can't interpret that any other way than the guidance they gave us.
So
Maybe
real
in the Department of
quick,
Health.
I got a message from the public to say, make sure you speak into the mics because they can't hear us at home. Okay? So, Greg, then Jillian.
One of the other things I wanted to ask was, there were a lot of comments about the teachers, having to tie shoes and do things like that. Are we going to have gloves in the classrooms for the teachers to be able to do this? And
I didn't hear the last part, Greg.
are we going to have gloves, hand gloves in the classroom?
Yes.
A lot of the complaints we were hearing
Yes, no,
were,
we've ordered gloves.
Okay.
Yeah, we spent quite a bit of time on what type of glove to order. We ordered the heavy, they're usable, but they're not the thin ones that you sometimes see.
Yep.
They should be pretty durable.
No, it's just because, like I said, some of the comments that we heard were tying shoes and putting on jackets and that were not protecting the teachers.
No,
so.
but we've ordered gloves for our staff.
Okay, thank you.
Jillian, go ahead.
Just 2 questions for clarification, more so for the public at home, things I've been asked or heard come through. When you say we would close down for 2 to 5 days for cleaning, you mean we're going remote?
Yes,
Yeah, okay, just so people are aware.
yes.
We
Nope.
could go remote
Yes,
very
no.
quickly.
yes.
And we're not gonna, kids aren't gonna lose massive amount
No,
of learning
That's
that.
No, we're going to
And-
go right into remote.
What is the procedure? Because it happens, every year it happens, the kids will be the first ones to tell you what happens if a kid pukes in a classroom. What is your procedure?
If a student throws up in a classroom, okay, obviously we'd call down to the nurse, we'd get the custodian up, sometimes, you clean the room up, obviously with that, and certainly call the parent, and obviously make that decision, with the
In
parent.
that case, we'd have to move the students out of the room.
Right, yes.
Until Dean and his team can get in there and clean it
Yeah.
out. And then, depending on how long that takes, it might be a period, or it might not be until the end of the day, and we just don't use that room.
Yeah, I was thinking we would, obviously, we clean the, pre-pandemic or during the pandemic, we move the students to another classroom and teacher.
Go ahead, Wayne. Go ahead.
Thanks. Sorry to have so many questions. You'd mentioned before the 5% threshold for, I think, the state going home. Is that our decision or the state decision, or how does that?
That's everything I've heard and read, that 5%
Okay.
is the threshold that gets departments of health.
Okay.
nervous.
The reason I ask about that is, so the data analysis I did, I sent to the board, and a lot of people know about it. If we look at the distribution in New Hampshire, so I reran the stats in August 6th. 419 COVID deaths, 77 not associated with the nursing home. So, we've got a state metric, but we've also got a metric which is most kids going to school. So I would just hate to, Hampshire is unique that way in that most of the folks that are having bad outcomes are not in schools. And so I just wonder if we can adjust that guidance based on the facts actually for the families coming to school?
That's not what the Department of Health is telling us. They, my gut, everything is that 5% threshold, and whether is it in the town of Hooksett, and the idea is that once you reach that, again, my understanding, not a doctor, so when you reach that threshold, the potential for spread or community spread increases because more of the population is being identified. Now, if you bear down and go, okay, well, where are they all? I don't think we'll have that information in real time. And again, this is all new to us, and the 5% threshold is wherever I read. I'll use where I used to live, Rhode Island. Rhode Islanders are being not allowed into Connecticut and into New York to travel, or they have to quarantine for 14 days because the percent of positive cases in Rhode Island is really getting close to 5%. And Cuomo and the governor of Connecticut, it's a big to-do down there, and that's because they're watching Rhode Island's rate, and it's bothering them that percentage of cases is increasing. And again, it's what's being used, from my understanding, as a threshold on that.
Okay, good. Well,
And we'd also be talking to the department, as I said before, it's not going to be Bill and Marge and my admin team sitting there going, oh, what do we do? We'll be in contact with Dr. Chan and his people and saying, look, we're seeing these upticks, these increases. Where are they? Is it something we should be concerned with? And it's quite possible they'll say when you hit that threshold, you might have to shut it down. And they say for 5 days in a row. So it's not like 1 day spike. It's a 5-day, pattern, or a 7-day pattern.
I have just a few things. I wanted to say thank you because I told Bill earlier, I think it's really obvious that a lot of time and attention was put into the protocols. It was very detailed. As far as temperatures go, I support what's in the document. I feel like now more than ever, this is a community event. Everyone has to do something that maybe they're not happy about or that they're not used to doing, or it's one more thing to add to your morning, but I have to take the temp for my teenagers to go to school. I don't know. I think it's okay to ask that of our parents. And I'm going to go out on a limb, be a little bit bold. And the point of wearing a mask is if I have my mask on, it's not to protect me, it's to protect you. So it should cover your nose, it should cover your mouth, and it should be on when it's asked to be on. If we are asking families or children and staff to come into our buildings wearing a mask, that's your option. If you choose not to, you don't come to school. You can be a remote learner, or you could go to a school that doesn't require that. I feel strongly about that. I think we need to clarify, again, exactly what we mean about over the ears or not. But if we're going to require a mask, us in this room as leadership are asking teachers to be in a classroom to speak, to instruct their children with a mask on. So if we can't speak clearly in a meeting with our mask on, what are we asking of our teachers? So that just makes me ask, can we safely, within 3 feet, take our mask off? Or is it 6 feet? If the teacher's in the front of the room with 6 feet, can he or she take the mask off? I just think those are some things we need to clarify because we know we sound mumbled and it's sweaty and it's uncomfortable. But I wouldn't take it off because I feel like that would be disrespectful to the people in this room that I respect. So that's my 2 cents. Thank you.
Well, again, I think, yeah.
You can clarify that?
Well, I'll just give you one more thing that I don't think we mentioned. The teachers we've ordered barriers for the teachers, the plastic barriers to teach behind too. I just wanted to let you know that. I think we missed that. And
Okay, for every classroom?
I believe so.
yes,
So they could take the mask off?
Yeah.
if they need to.
And my understanding, again, we can call the department, we can call Chuck, or whoever answers the phone. We talked to Chuck a few times. And ask, but my understanding is if you're less than 6 feet, the mask has to be on.
correct.
if you're 6 feet or greater, you're okay. Again, that's what I've read and what they've said to us. We certainly can check it, but I think having the glass or the plexiglass divider would certainly help the teachers, be able to say, okay, I can drop it at least for a couple minutes, or be behind it to talk to the students.
We good? All right, Greg, go ahead.
No, just to Kara's point, we keep going back and forth about cloth face coverings and masks. Everything that I've been reading here, they actually have it as both. So, like, I'm looking at the Department of Education's recommendations that they put out, and that's how they word it as well, is wear cloth face coverings / masks, and maybe that's how we should word it in ours as well.
What was the date on that? I think it's changed since.
Well, no, actually, I just confirmed with Lindsay, too, because she's got it right up there, too.
However you would like to do it, we'll obviously make the change. Just know that it could change,
Tomorrow.
But however you want to define it, we'll carry it out.
And that's actually, so to your point, Kara, so again, you can tell you guys did a ton of work, obviously went way over and above. Again, we have to keep in mind, we can put some general parameters around this stuff, but things are going to be changing and things are going to be fluid. You know what I mean? As we get in school, to Bill's point earlier about the 5%, Wayne, I think, again, you're right, like a lot of old timers have this, et cetera, but I think once the kids go to school and stuff like that, there may be some impacts that we're not aware of right now, even with all the protocols that we put in place, that type of thing, so.
And again,
you know.
and I know, we will probably get to the survey results, and we're taking a lot of precautions. Where you're seeing the upticks like down south, where they didn't have their students wear masks, they did not social distance, and you see the outcome. So, again, we are not going to be that, that famous picture of all the kids in the hallway and the poor kid got suspended for taking the picture. That's not going to be what's going on in our schools. Our kids will have the masks, our staff will have the masks. We're doing everything we can that we know of to keep everybody safe. With that said, I can't emphasize enough, the situation may change so quickly, we may have to close down and go to distance learning. We've talked about it a lot. Our goal is to do our best to open and stay open as long as possible, with the understanding there are all these other, things that we can't control that could impact our decisions. So I'm off my soapbox. I say it every meeting.
All right, Lindsay, one more and then let's move on.
Okay. And just going back to our masks, I know we talked about a video that will be going out and some training. I think it would be beneficial for parents, especially, I know my guys really haven't gone, really anywhere with a lot of people. So we're not in the habit of it, but it would be good as we get started to kind of teach the kids as well and remind them, if they're sitting 6 feet apart and they have their mask off, that's fine. But if you have a question and the teacher needs to approach you, put your mask on. That's not going to be common until they practice it a little bit. Same thing, whether you're getting help from somebody, don't necessarily go up and be face to face with the person. Go to the side of them. Approach from the backside. I mean, there'll be tricks that the teachers will get used to doing so that they don't have that face to face when the risk is higher of, the transmission.
And again, we're going to be having those conversations with our teachers. It's really all new, obviously. But, we've asked the teachers to come in and take out some of their personal items so we can have the space in all our classes, so we can do just the 3 feet distancing, so we can get all our kids in. And our teachers have been good. They've been coming in. They've been taking their things out. And, as Matt said before, Dean and his teams are getting the classrooms ready, for September. So I guess the question is, do you want us to clarify, use the term, I wrote it down, Greg, if I get it wrong, let me know. Cloth face masks coverings. Did I get that right?
So it should, everything that we're seeing so far should be wear cloth face coverings / masks.
Is that the consensus? We'll make the change, that's not a problem. I don't think you need to vote on it.
Again, that could change.
Yeah, we can do that.
All right, so who's doing in-person remote learning? Marge?
Matthew?
Matt?
So last time we had the conversation, I think you had, one of the board members had said, what would a day look like for the students, whether it's in person and remote? And when we had, the recent survey, the undecided, a lot of the questions that people had who were undecided about what they might pick when that new survey comes out tomorrow was, what will it look like? So the principals have put together their schedules and their ideas for distance learning. So Matt, we'll start with, his school.
Okay, so here's the Colley in-person schedule. It's similar to pre-pandemic, where students we decided to leave the blocks of time because as the middle school teachers, we let them manage their time within their teens. So for example, you see that a core class goes from 8:35 to 9:35. So what I've told the Colley committee is basically, yes, it's 60 minutes, but there's going to be some transition time, and we don't have bells here like we did when we were in junior high. There's going to be some transition time within that 60 minutes. The teachers are going to be rotating to their next classes, certainly getting prepared. Students are going to be, the hand washing, sanitizing, getting up and stretching, when applicable, maybe a mask break, but it has that built-in time for those transitions. So as you see, core classes are 60 minutes and unified arts classes are 45 minutes. But we really didn't want to shorten. If we shorten the time of class, we would be shortening it even more. So that's why we kept the 60 minutes, full well knowing that that time is going to be because of the new routines and protocols that we're going to have to do. So remote learning. If a student selects remote learning, the curriculum and pace is going to be similar to school instruction. The teachers who are providing remote learning classes, they're going to send a letter home, a welcome letter, with all the information for their class, where to find their class, how to use the Schoology learning management system, how to Zoom video conference. Students will be required to attend language arts, math, social studies, and science classes daily, and that's through the live Zoom video conferencing. Now, the schedule for remote learning, they're going to have 60 minutes, but the schedule is going to be determined once I know the amount of students and the staff that's going to be able to do that. That day will happen between 7:40 to 2:40. So they'll have those classes. 60 minutes is the maximum. Now, they're not going to be on the computer for 240 minutes straight. What we like to do is give a time of 60 minutes. And so maybe the teacher frames the lesson, teaches the lesson. There's some small groups. In the Colley document, at the discretion of the teacher, is when students could sign off. So today's a 30-minute lesson. I mean, they wouldn't say 30, it would just be natural. Okay, guys, why don't we check in? Whoever would like to stay on, or I'd like you or you to stay on so we can provide additional support. In addition, there is going to be small group and individual instruction that's going to be scheduled throughout the day. We're going to use the traditional grading system for all, for in-person. If we shut down, if you choose the remote learning option, we're going back to the traditional grading system, not pass incomplete. Through the new learning management system, Schoology, that's the way students will access information from their teachers and certainly submit work. I'm currently working on how Unified Arts could be implemented remotely. It's a challenge right now, and again, I'm going to need to know certainly where, how many students take remote learning. We do have teachers here who come in for the in-person learning that will be teaching five or six classes. We haven't decided yet on how that's going to go. So currently, we're trying to determine how a teacher here would do that, or if we have a remote teacher that could offer that. We've looked into VLAX, and that is a correction. I'm not sure, I just found out late, some of the VLAX classes for Unified Arts classes are full, and there's a waiting list to get on them. I just wanted to be certainly honest. So we're looking at that. But I do know there is a plan for language arts, math, social studies, and science. Students can participate in extracurricular activities. They are full-time students, so if their parent selected that, they can participate in that. Are there any questions before I turn it over to Ben and Steve about Colley? Oh, and before I get to that, Mr. Rearick, sorry. Mr. Rearick mentioned if a student is quarantined for 10 days because of a COVID-related protocol, that student will have the opportunity to live stream into their in-person class, okay? The teachers on the committee felt strongly that they wanted to keep those students within their class. They didn't want to switch them over to remote learning. Yes, the pace will, and that's why I put the word similar to school instruction, but it could be a day off, 2 days off, or on a different point. So the teachers felt strongly about that. We'll give parents the option of live streaming in. And a lot of our teachers, not a lot of them, all of the teachers here have done a very good job in the past if we've had students out for 10 days, or if we've had students, for vacation, for other thing, where we communicate that work. So they will have the option, if they're quarantined for 10 days, they won't go into the remote learning class. They will stay in their in-person class and have the ability to live stream in through Zoom.
Good, Lindsay?
I just have a question about UAs. Are you saying that by the start of school, we will figure out how to incorporate UAs? Or if we're not able to, and this does go all year, what will those students do about those required courses?
So, I'm not sure required, for some of them would be required. But, so to answer your question, to be frank, we're working on it right now. I really have to determine how many students and how many teachers are there. If I have a particular option where, we have a limited number of 8th graders come back, that's going to free up a period for a Unified Arts teacher to possibly deliver a remote instruction class. With cohorting, remember, students aren't moving to classes, so I have 8 homerooms per grade levels. I need to cover and have 8 Unified Arts teachers teaching those classes. And we've talked, and you know that Spanish and French in person, they're going to move to another classroom, okay, and that's when feasible. So there are certain classes like that. We're looking at all options. The plan is to offer them that, but currently sitting here, without knowing the numbers and everything, it's difficult for me to say, I'll have that answer for you. The goal is yes, by September 1st.
And if we can't, we'll certainly, we're going to need another meeting before, probably by the end of the month anyway. So we'll be able to update the board on that. But it is a challenge right now, especially not knowing where the children are. Again, as Marge mentioned, we will be sending out the survey tomorrow, asking parents to declare in person or distance learning. Once we have that piece, we already have the teacher piece, and we'll be able to start building that online schedule. I'm sorry. We'll be sending the survey out to our parents tomorrow, asking them to declare in person or distance learning for their child or children. We already know what our teaching staff looks like for right now. We plan on using the vast majority of our teachers that can't come in for health reasons or EFMLA reasons for distance learning. We're also in the process of trying to negotiate with the union, and I mean in a good way, is to allow teachers, possibly allow teachers who are in other districts where their child's schools have shut down, or they're in a hybrid model, and it might mean that that teacher would have to stay home. They're protected under that E EFMLA language. So if we can find a way that if it doesn't cost us anything for their child to come here to attend school in Hooksett, if it means not losing a teacher to it, it's something that we are currently trying to work out. So I believe that's another 5 teachers that fit that category.
Hey, Bill, can you address real quick the flip-flopping? In other words, when you select something, you can't just be flopping back and forth between remote and school.
With this, we talked early on about policies, the need for policies. And we are going to need some, and one of them, I believe, will be a distance we need a distance learning policy. We want our parents, our students to pick and then stay for a trimester, simply because we don't have a whole lot of capacity to move, large numbers of kids moving back and forth between distance learning or in person. We know, for example, if children are sick with the COVID symptoms and they're going to be out for an extended period, we know they're going to go into distance learning, the distance learning model. With the policy, I still think we need to have some language that allows parents to present their case to the principal to say, look, there's an extenuating circumstance, can you please move my child? And that we allow for that, at least that appeal to take place, and to allow the discretion of the principal and myself to move people. But for the most part, if you're in, you're in. But we need a policy that kind of encompasses all that. Because you can't have a policy that's just, this is the way it is. It's usually, parents can appeal anyway. It's their right to appeal. So I just think it's easier if we create that policy, for that. So, yeah, we want them to stay for the trimester. But as we create the policy, it might be an extenuating circumstance. But by and large, everybody's in the model that they pick.
Greg, you want to go?
Do we have a game plan for teachers that are doing the distant learning or remote learning if they're out sick?
If they're out sick,
What we're going to do with that?
don't touch it.
I can't touch it now. So, Oop. Oh. Sorry about that.
It's not me.
That was me.
Take it out. I'll rewash it.
So basically, like in distance learning in the spring, I know in the Colley document, we put if a teacher is out sick or can't be able to obviously teach that day, they will leave something on their Schoology management, and there will, I believe, we can actually give a message, push a message out that the teacher, there will be no Zooming today, and please complete this, this, and this, and we'll touch base tomorrow, or whenever. Thank you.
Go for it, Steve.
We're all set. All right, hello, everyone. Just a lot of what Mr. Benson said is similar for my school and actually similar for Underhill. This is a sample in-person schedule, and it really applies to any one of our grades, where it's just, there's a focus on hand washing when the kids are arriving, morning announcement, morning meeting. We're focusing primarily on our reading and language arts blocks as well as our math blocks, especially in our 3rd grade. Our 4th grade, you might pick up the science. 5th grade, you'll pick up even more. But really, when they're in school, we want to make certain that we're providing that instruction in those areas. Unified Arts class will also happen, and those Unified Arts classes, for the most part, will travel to that classroom. Unless they're able to get outside. We see, that obviously as much PE as we possibly can get outside, we will. And then some of the other Unified Arts areas, we also see that happening. One of the things that you don't see on this particular schedule is the fact that there will be breaks set up within the day at various times for a mass break, if you will. So a chance to, again, weather permitting, kids outside, social distance, get a little bit of time without that mask on.
And Steve brings up a good point. The social distancing, because I can't remember where we got the question asked, but it was, well, why can't kids just go to the cafeteria or the media center if it's not being used? Well, that means somebody would be possibly, spreading something if you did it in the building. So outside is where we want the breaks. And again, the flexibility will be set times, but there'll also be flexibility for the again, they just have to, it's like, when do you let a child go to the bathroom? It's the teacher's discretion. The same will be for the masks breaks. Again, it's going to vary from age group, it's going to vary for teacher and the composition of the kids. So again, we have to be as flexible as possible regarding those mask breaks.
Yeah, and Bill, I agree 1,000%, because it's one of the things where you want that flexibility so that if, as you said earlier, if the teacher notices that the kids need a break, the same way they do on any given day, if this is a mask break, they're outside and they're doing that. One thing with this caveat, and actually goes with both this and our remote plans, is it's all based on staffing levels and that student population, so the schedules are going to change a little bit depending upon who is where. So, yeah. Thank you, Marge. So the remote learning schedule, it's going to vary a little bit by grade, but depending on the development levels. The older kids are going to be able to sustain a little bit longer, have more complex sessions. The remote schedule will be determined based on the amount of students that enroll. So we've got to take a look at how that all plays out. Zoom sessions are going to vary in length, and this is kind of that bridge between the Underhill School and Colley. Grade 3 will have about 30 minutes of Zoom per session for math and ELA. 4th grade, we're expecting a little bit more, that 45. 5th grade, about 60 minutes, give or take. And then students will access and submit lessons through the Schoology learning management system that Mr. Benson talked about. Curriculum and pacing is going to be similar to the in-school instruction. Obviously, there'll be some differences just because of the mode of doing that, but the expectation is they're all in the same place, relatively speaking. Students will attend reading language arts, math classes daily via Zoom, and that's whole group and small group instruction. So again, you might have the teacher deliver the beginning lesson at maybe 10 or 15 minutes, and then the kids would stay either right within that Zoom, go into breakout sessions or breakout groups, and the teacher would work kind of similar to what they do now in small groups in Zoom sessions. So we see that happening. In 3rd grade, science and social studies are more embedded into the reading program, the Wonders reading program. 4th and 5th grade, you'll have a little bit of that embedding in the Wonders program, but we also want to pick up and start adding the science and social studies specifically in those areas, and that will be incorporated into schedules as we move through there. Live lessons are going to be recorded and made available to students if they're not able to attend at that scheduled time. And those recordings will be available after the school day. We want the teachers to have that time to be able to upload. Small group and individual instruction and office hours will be part of the schedule. We're planning on about 60 minutes where that may happen. But we'll do some give and take on that, again, depending upon the need, and we'll obviously be flexible with that. Grading and report cards is the same as if it was in person. We will not be doing the passing complete. And pre-recorded unified arts classes are going to be available to families daily, allowing students and parents to select the best time for them to do their UA activity. They will have some type of requirement to turn in a log, a paper, what have you, through the Schoology system. So I see that the Unified Arts pre-recorded lessons may be similar to what we did in the springtime, but a little bit more choice. For Memorial, I see it being almost a choice board, so that kids can select the things that they want to do on that particular day, and then still be able to turn that in. We're still working that through. Again, it depends, like I said on that first slide, on what staffing looks like and what the kid volume looks like, so. All right. Good. We're good?
No, I was just going to say, I appreciate the sliding scale of remote time based on the age. I think that makes a lot of sense.
Yeah, thank you.
Ben?
There you are, Ben. You're welcome. It's teamwork.
There's a lot of options.
Oh, boy.
Well, 3 are for kindergarten.
Hold on, I gotta apply my chemicals here. So, Underhill's in-person learning schedules, as you can see here, I have 5 different schedules because we have the half-day program. There's the morning session, the afternoon session, and then there's the pilot program for the full day. And there's a first grade and second grade schedule. And as you can see, it kind of mirrors what we have had in the past with our academic schedule. We've budgeted in some time for hand washing and that the arrival time where we anticipate that it may take a little bit longer only because we're bringing kids in and we're spacing them out, just taking our time with that. And that may be adjusted as we kind of get used to our new routines and may actually get a little bit faster as the school year progresses. We had originally built in bathroom breaks. We were looking at mask breaks, but again, going back to something that was mentioned earlier, we really will use teacher discretion to take the kids to the bathroom when they need to in small groups, or they'll take their kids outside for a mask break based on when they think they need it. So the teachers will definitely have that flexibility there. But it is something that we'll make sure that happens, and we'll work with the teachers on what they can do for mask breaks and where they can go. We certainly want the kids outside as much as possible. And the middle of the day is actually the busiest part of the day for Underhill School because we have lunch, we have recess, we have kids transitioning from preschool and kindergarten in and out of the building. So we're going to be really, really busy during the middle of the day, getting everybody situated with lunch and cleaning rooms and disinfecting. I worked with Dean on a schedule, and it appears that we're going to be able to make all of those things happen within 2 hours when the kids are eating lunch and going outside. So all of that's budgeted into the existing schedule, as you see here. So what happens with remote learning for the students who have selected the remote learning option is the kids will follow the in-person learning schedule. So it'll be similar. So if I'm a first grader, my reading block will be at around 9 o'clock or 9:05, and I'll sign into my teacher's class, and the instruction will begin. So the teacher who is responsible for the remote learning will not teach straight through the day. There's going to be breaks built in, and similar to Steve, we'll look at the developmental appropriateness of how long kids can sit, and the type of instruction that happens, and the types of activities that are being presented to the students. So if I'm a kindergarten student, it may be almost like mini lessons. So there'll be a brief instruction, there may be some modeling and practice, and then the kids are off doing some practice at home or with their care provider. In first grade, it might be a little bit longer, only because of their age, and they're able to maintain their attention a little bit longer. And then in second grade, the same thing, it'll be a little bit longer. But we anticipate that there's a total of 2 to 3 hours daily for the students who are in first and second grade for instruction and also completing assignments. In half-day kindergarten, it'll be between 1 to 2 hours daily of lessons and activities as well. So the key is following the structure of the day and having breaks in between the lessons so that the kids can get a stretch break, a movement break, a wiggle break, whatever you want to call it. And that way the teacher can also kind of reset and then start the new lesson. So there's going to be whole group instruction that's being done, and also small group instruction, so the kids are getting a little more of that individualized instruction as well. You know, we'll also be able to offer unified arts. You know, as of today, based on the current staffing levels, you know, we'll be able to provide unified arts. It will be a pre-recorded option for kids to complete during the week, but it will be offered to the students to complete. The lessons are going to be recorded, so they'll be made available to students. If they, for whatever reason, can't attend in person, they'll still be able to, you know, view the lessons and also complete the work that's required for the day and get credit for that day. So we'll follow the same grading policies. We'll still follow the report card practices. We'll still follow the attendance policies as well, just to mirror the experience to the best of our ability to, you know, what we're doing in person. And, you know, we're still working through a few of these things, but I think one of the important pieces to, you know, the remote learning experience is having that teacher assigned to the student, or vice versa, having the student assigned to a teacher, a go-to person, and that will be their teacher for the year if they elect to stay out all year, or for the trimester. So they'll have the same teacher, you know, for that time. Any questions?
Lindsay?
I have a couple questions, and I know you will, but as far as drop-off and pickup for your half-day students, that'll be, we don't have that in the policy that went out, so that'll probably be, right, or did I miss that? It's given out to the parents as far as what time they can pick up and where and all that?
Each of the principals will be releasing their own school's protocols.
Oh,
This is an overview, you know, the 30,000-foot overview, but each of the principals have developed, and it will have that, there's maps showing, you know, the pickup and the drop-off. Steve and Ben have them included in their plans, and it's much more detailed than what we provided for the protocols are embedded with everything else that they want. What we provided tonight was really the key protocols that parents, I believe, need to know in helping make an informed decision. They'll also get their child's school's plan tomorrow. So they'll have what we've talked about tonight, and then also what the principals send them. So I believe they should have enough information. But again, as always, if they have questions, they should just reach out to Ben, Steve, or Matt.
excellent.
Yeah, so it's going to be, you know, in my building plan, and there's going to be, you know, procedures that go with that, and also a map with arrows directing them to, you know, where they need to be.
And Steve has the same, and I believe Matt does as well, to show the flow of, just for more for the parents,
Yeah.
maybe for the, not so much maybe for Ben's kids, for their age group, but certainly for Steve's age group, you know, to go over it and say, okay, this is the new rules. You know, it's just not like it was, like kind of, you see in the movies, you know, kids running out at the end of the day or running in. It's usually out, but not in. But, you know, that's all, as we've highlighted, it's going to be different. And that's reflective in their reports.
I just had a quick thought when you said about the pickup for half-day. Is that part of your meeting tomorrow with the,
Yes.
because I know that's new this year. Okay.
Oh, yeah. That we've already talked about, but it's something we have to finalize.
Can I ask another one? And maybe once the numbers get meshed out there, it won't even be a question of mine, but with we have here talking about half-day for kindergarten and the amount of time during the remote, do we have, or I guess we won't know yet till the survey comes back, but what about any full-day kindergarten? Or is remote really not an option? Like if you don't want to be in school, then you pretty much need to go back to half-day?
It really depends on the numbers. Yeah, I don't know what, you know, we're going to have for, you know, students in the full-day pilot, selecting the remote option. I think that's a conversation that, Bill Marge and I will have to have about, the staffing and the needs and how that could or could not work. So that's something that we'll have to figure out.
Yeah, just a quick question, and I know it's probably different per school, but last meeting we had talked about back-to-school assessments, and I think we discussed delaying that a week so folks could adjust before they had the how did they do over the summer assessment. How does that differ remote versus in person? I'm just curious how that's going to happen for kids in the two options.
Yeah, so there are certain things, sorry, do you want me to answer that?
Go ahead.
So there are certain things that we can do, remotely, where we administer assessments with students one-on-one. That's something that we could possibly do remotely through, Zoom, because it's a live interface. So you can listen to a child read or identify letters and things like that. And that's something that we'll have to set up procedurally. But with some of the larger scale standardized assessments, I'm not sure how that's going to work yet. I think that's something that, Marge and the principals and Megan will have to figure out because of, the standardization and test security.
So Wayne, just some additional information on that. Last year, we did not do NWEA online, but because most of the country was shut down, NWEA did come up with a way for us to do that for the remote students. I don't imagine that we would do it with the remote kindergartners, but I think we would do in kindergarten and first grade those individual Zoom calls with the students, and maybe we would begin a remote test like that in second grade. However, the state assessment this year in the fall, we're starting in fourth grade because it is really last year's assessment. So it's possible we'll be doing the state assessment twice this year. So I believe that in the spring, if we do it, we'll be doing that 3 through 8 for those remote students.
And it's important to note that the fall assessment was the directive from the DOE to do 2 for us. Ideally, we'll have 2 in, but the goal is to try to capture where our students are early enough in the school year so we can adjust our teaching strategies.
Greg, you want to go?
So yeah, I just had a couple of questions. I know we discussed this last time. Do you know where we stand on the Chromebooks? Do we have a rough idea as to when those will be in?
The Chromebooks are back ordered till October.
Okay.
Matter of fact, Dan and I were just talking about it prior to the fire alarm that we experienced before the meeting. Is that, again, this is a worldwide thing.
Yep.
I even had Dan go to, the Best Buys, the Staples. It's the same thing. One said they could give us a better price, but it would be November as opposed to October 23rd, I think is the due date for the new ones.
Yep.
Dan, do you want to just again remind everyone where we are with what we have in stock? I think that would be helpful.
Hello. So currently, for devices throughout the schools, we have enough at Colley to cover the one-to-one, since we're already doing that. At Memorial, we would have enough for, I'd say, to cover 1 grade level, possibly. Similar situation for Underhill. Depending on what you want to do for testing, these devices would have to stay in school initially for students to test on, so they wouldn't get deployed out, and then you could assign them after that.
Thank you.
Sure.
I wanted to just add something. It's really Lindsay's idea. It wasn't mine, but I thought it was a very good idea. We were talking about this at graduation last week and had the suggestion of when we do give some out, because we also have some at Underhill as well, that we give them to the students who are remote who do not have a device. So I think we would consider that. Lindsay's idea.
Thank you.
Thanks, Dan. I think that, are there any more tech questions for Dan? Okay.
And I guess a couple of things. Lord forbid this happens and we end up having to completely shut down again on the plan for going full remote. Is it going to be basically just a shift of the teacher and that classroom just going right to Zoom?
Yes.
Okay.
Yes, in other words, for everyone who's in person,
Right.
they and their teacher would then, what you just saw here, everybody would follow. In other words, this is really our blueprint, and this is what we'll shift to if and when, whether it's, maybe it's that 2 to 5 day window, or, who knows, but if it's for an extended period, that's what we're going to be doing, if we have to close it down.
Yep, great, thanks. And last question I have right now is, are we still good for September 1st? Do you think we're going to be able to be okay with that date, or?
Still good for September 1st?
Yeah,
I can't give you a definitive answer. It's possible we may need some more time, but we're not quite there yet. I think
Okay.
we'll know more once we get the results back, because, and not behind the scenes,
yep,
how the magic's done in Disney World. Normally, our principals have a whole list of things that they have to do normally to get open. That's all been put, and I'm simplifying, has been put to the side, and we've been focusing on getting this up and running. So it's quite possible, and they're still trying to do all those other things, is that when we're, I don't know what kind of bumps we might have developing the schedule. We may want some more time, depending on what it looks like for our teachers. So it's possible I may come back to the board and say, we need another, we need more time. That's a possibility, yes.
okay. Yeah, no, I figured that might be, so that's why I'm asking. Thanks.
Okay.
So kind of what you just said probably falls under that, but the opening, like the orientation days for new students coming into a building, is that the kind of stuff that's kind of being pushed out a little bit?
So, obviously, I get a lot of this
Smiling if you
stuff
can't tell.
I get a lot of this stuff done in July. I'm usually emailing Mr. Harris about sixth grade orientation for 2023, driving him nuts with that. So, yeah, those are the things, we've got a framework for that orientation, but it's just things that we usually get done, staff handbook, letters out to parents, just the traditional opening of school that we do that's quite cyclical. So,
The staff, normally we let our students know who their teachers are, et cetera. That's all been put on hold because we simply don't know who's coming and who's going to be in person, who's going to be distanced learning. So that's just a snapshot of what's still up in the air. So it's quite possible I'll be coming back saying, we need to push it back a little further.
I just
Or a
wanted
combination
to, I
of-
figured that was the case, but there's a lot of
Right,
people
and-
asking questions, and I think
And it's
anyone that's
it's a
listening-
combination of just getting what we have to get done, but also, do we need more time to help train our teachers? Do
Sure.
we need more time with the reading program? Do we need more time with the learning management system? It's all quite possible that we may say, yeah, we gotta
Yeah.
push it back a little.
We just need to ask families to be as patient as they can in waiting for that information, that it hasn't been forgotten
No, not at all.
at all. It's
No.
just being worked on.
And we are gonna have it.
Absolutely.
We
Yep.
are gonna have the orientation nights, the tours. I know the principals are working on their videos. It's just a matter of when we'll drop.
I'm working on I drove Mr. Rurick nuts today with about the high school fair letter that I usually have done. He's like,
Yeah, I go, what? He goes, well, I got a school to open.
I got a school to open and I got to get high school because we need to get those things, so.
So Lindsay, then Wayne.
So speaking of needing all these numbers, how long, so the survey will go out tomorrow. How long are you giving families to respond?
Tuesday
Okay.
will be the, Tuesday noontime or something like that. We may even make it Monday. Marge and I still just have to figure out how much time. I think most people know.
Yeah.
And if we drop everything tomorrow in the sense of the individual plans, I think most people are already decided, and if I recall, and this is the data, this was the temperature check data. we got about 22%, 21%, so we're doing full remote, and we didn't even have that yet. And about 17% are undecided. So I'm going to assume, kind of like in a general election, presidential election, that 17% number will drop somewhere, obviously in the other two. Once we get that, we can then start saying, okay, again, like I said, we know who our teachers are. We just need the last piece to the puzzle, which would be our students.
Yeah, just possibly a quick question. Special ed across the three schools, is that largely shaped by the survey results and they come back tomorrow?
No, because we have to provide the services. What it will mean, and I'm kind of making it sound easier than it really is, but Chris and her team are going to have to provide the service. If a parent picks remote learning, that we got to figure out how to provide the service for them. Depending on what the services are, we'll offer the opportunity for the parent to come in or bring their child in for the support if it's appropriate. If the parent doesn't, then we'll have to go to the child's home and/or do something via Zoom or distance learning. But the child's IEP will be supported,
Thank you.
regardless of what choice.
Thank you.
Okay, we're good? All right, so,
Can I just have a vote on the protocols? And with
Motion?
the change or the clarification regarding the cloth face covering / masks.
I'll make a motion to approve the Hooksett School District reopening protocols for 2020, 2021 with the addition change for cloth face covering / masks.
I'll second.
any discussion? All is in favor?
Aye.
Opposed? Good, unanimous. All right, so let's go to the next sub-rate of pay, is our next.
Yes, I sent out, I apologize, as I said in my second email, I gave the non-instructional rate at first. Currently, we have a $75 substitute rate. This item's on the agenda because we talked about possibly increasing the rate so we can make ourselves more attractive to grab what available subs are out there in southern New Hampshire. And I provided the different rates for you just so you can kind of compare where everybody stands. Now, I'll guarantee you this is going to change because we're not the only, we're not the only ones that go, oh, let's increase our sub rates. But this was as of the end of the spring.
Yeah, thank
He
you.
did ask a good question. He's emailed me. He asked, did we use any subs during the, when we were out? And the answer was no. So essentially, as of March 13th, our sub use stopped. Because as Matt described, that's how when a teacher was out, that's how we covered it.
So, I reviewed a lot of these, and I'd like to make a motion that we increase the substitute teacher rate of pay to $80 an hour, and, what's that?
A day.
I mean, a day, sorry.
$80 an hour.
We'd have a lot of people coming.
A lot of ears just perked up.
I'm sure. I'm sorry.
Yeah,
So,
Amy, if you're listening, pick yourself up off the floor.
I think she just fell on the floor.
Yeah, that thud in on the coast.
So, I'd like to make a motion to upgrade the substitute teacher pay to $80 per day, and I believe we have a stipulation somewhere along the line that after 20 days, they get an increase, and I'd like that increase to be 90 days. $90. So-
After 20 days.
Yeah, so if they've been in our district for 20 days, it bumps up to 90.
And that 20 days, just to clarify, for Auburn and Candy, are not consecutive. It's a cumulative. So if somebody, people who come and are regular subs, we wanted to reward them. You do it 20 days, you get the extra, in their case, is $5.
Exactly, yes. Thank you.
I'll second for discussion.
Yep. So, floor's open for discussion.
So I had asked Mr. Warwick for the numbers. So obviously last year the numbers were different because we were remote, and so he's 18-19, we had 673 and a half teacher sick days and 243 personal days. So that's 916 and a half days that we had need for subs the previous full school year. So at the $75 rate, that's $68,738. It's not a big number. I like where Greg is going here. I would like to go further with that. Bumping that rate to $90 is a 13.7 thousand increase. If we were to top the scale at 100, it's a almost $23,000 increase. So we need to be vigilant of our spending, but we're going to have increased demand, and we need to be positioned to take advantage of people. So take advantage of available people. So although I support going up, I would like to amend the number to $90 an hour. Or sorry, I did what you did, 90 a day.
Hey, you guys are just giving the money away.
Hey, yeah.
Budget committee also.
Any other,
too.
any other discussion? So are we going to, let me ask this, do we want to dice it up between like someone who's non-certified and somebody that is certified?
I would
To drive
I would
for-
recommend that you just do
A single rate?
substitute, a single rate. It's just, it would be a nightmare for them to have to track that.
Okay.
At the office.
Interesting. Well, I suppose the idea is too, if we pay more, we're more likely to get a certified person, right?
Yes.
Okay.
And again, it's a misnomer in a sense, the term certified, because in New Hampshire, you just have to get certified as you're certified as a sub if you have a college degree, and/or I think now it's 18. I get my two states. I still have what is it, dysphagia or whatever, where you
Yeah.
fade in and out. But the rules are very easy to get quote certified as a substitute versus a certified teacher. That's
Yeah, me too. Well, no, I thought there were two different rates, but, yeah.
oh, that's right. You got the other
Yeah.
chart.
Yeah.
It's
Okay.
up to you guys. If
So Greg, you want to amend your
that's like
motion?
Amy
You wanna go-
presented it that way, so if that's how you want to handle it, again, we're easy.
So Wayne, are you looking to just do one flat rate of 90?
I think the 20 days is a good incentive, and we have a policy that supports that, so I think
Yeah.
there has to be a bump at the 20-day mark, so
Hey,
we have
Wayne,
consistency.
Just I'm not a procedural whiz here. Are you asking to make an amendment?
I did propose an
Okay,
amendment,
is
so I
there
would need a second.
for the amendment? I'm sorry.
What- Can you repeat?
Oh, sorry. So I had,
I mean, I'm not a
I'm just
Robert's
trying to
Rules
move it
guru.
along.
I believe me, it's
oh,
good.
thank you. So the initial motion, second was for $80 an hour.
We're all on hours here.
Per day, $80 per day sub rate. I have motion to amend that to 90, so I would need a second on my amendment to make it 90, and we could discuss the amendment and whatever.
A second for the amendment? Because we can still discuss the other aspect of it if you want to. You know what I'm saying?
Yeah, I'll second it for discussion.
Okay? So,
Yeah, so,
You could increase the back end,
correct, that's what I'm saying. So you can,
right? In other words, what Greg recommended, the 80, was it 80? Instead of 90.
95 or something.
Whatever,
Yeah.
you can just change the back end if you.
95 for the 120 days.
So you're saying
Yeah.
bump it to 90 a day, whether you're certified or not, and after 20 consecutive days, go to 95?
That isn't in there yet,
Is
but-
that what you're
Yeah.
saying?
We could amend it to that, yeah.
We could amend it,
I
yeah.
would be amenable to
We
that.
could amend the amendment,
Yeah.
yeah.
They
That's if
were,
you want to. It's just a way to.
Or we could just go with the 90 overall and be good.
Or you put in a certified rate?
I do like the incentive, though, of
No,
trying to keep somebody coming back for the days, for 20 days.
For sure.
Yeah.
But we
I-
need, I'm kind of thinking we may need to add a certified teacher rate.
So we
well,
I mean, Bill just said we don't need to.
do a corresponding.
We don't, but
Yeah, I mean, I think, to that point too, Greg, I think your point, I mean, if we do this, I think, because we talked about the building sub and really can't do that this year, so if we make the rate more for somebody who stays 20 days, they may be kind of like a building sub because they stick around, you know what I mean, in the
Yeah,
interim?
I'm
Does
gonna.
that make sense?
To kind of make it even cloudier.
Gee, thanks.
I know, it goes to what Phil said, and this is, I'm still learning, even though it seems like 1 year, it's like dog years, 1 year's worth.
You don't look 7 years older, Bill.
Yeah, well, when you don't have hair, you always look younger than you really are.
So,
Can you explain the certified, non-certified?
so we have traditionally had the certified rate and the non-certified rate. So I don't know if it matters if you're just going to do one, but we have traditionally had the two rates.
Okay, that was not in the chart we got.
Right.
Okay.
I thought we did, but can
We
you
did.
tell us what it was?
What are the rates now?
Or maybe you don't know. It's okay if you don't.
Uh-oh.
Actually,
We're all working on something.
I do have one, because if anybody wants to look at it, I had asked
Do we have
Amy
a
for this
para
earlier
rate
today.
too? I think that's important to this
Oh.
discussion. So paraprofessionals, because they're even, to get a sub for a para position is even harder than a teacher. Do we have a separate, most districts have a separate rate for that as well? So that would be important to this discussion.
The answer is yes, I believe we do. Again, not the Roberts rule, to be the rule of board, the Roberts rule guy, we can put that on the next agenda, because when we talk about sub-rate, I mean, you guys can, I don't want to bend what we're.
You want to table it till the
talking
next
about.
meeting, so that
But-
way
I
we
think
at
it's a
least put the
good
real
point.
numbers?
Jillian,
need
did
to
you
address.
mean paras in general or paras who are you're substituting as a para?
Substituting as paras.
Substituting As a parent.
Yeah, so I think we could lump that in, because
Okay.
if you get brought in
However
as
you
a sub that day, you could be a para.
Because I want to say that was 65, our sub rate is 75, and then certified, especially if they're doing long-term, is like a portion of whatever that salary would be for the year, typically in our district.
Oh, Christine? No? Can you help with this?
Can I add one more? Because I see in our chart here, several districts have a nurse rate.
Oh, God.
And then-
We're really making this convoluted.
I know, but I think Greg is holding the answer in your hand, no?
Well, what I have here for us is, and I'll explain it. So I had asked Amy for this earlier today, and it's a chart, and it clarifies substitute type. Certified teacher for Hooksett, $75 a day. Non-certified teacher, $65 a day. Licensed nurse, $125 a day. Maintenance office personnel, $10 a day. And food service, $10 a day. Hourly. And maintenance office is hourly.
Does it break out the paras or no?
It does
It
not.
doesn't. That's what, the list we got didn't break it out, Jillian. There's like no para rates in a lot of these numbers that we.
Again, if you can, put the para question, I believe we need to address it, but let me talk to Amy so we can provide more backup, so we make an informed decision instead of making a decision and then me having to come back and go, sheepishly, I think we made a mistake. But I do believe we should address it. I just
Jillian,
want to be able
I'm
to.
just bringing it up in the fact that I totally agree we need to pay our subs more. We have a sub shortage, but I'm also thinking about the budget and having to hire more custodian. Like, we're still talking about trash pickup. Like, I just want to make sure that we don't go too crazy, because I'd like to address that possible para issue. You know, what do we have to hire this year? Like, I just want to make sure we're looking at everything.
And Jillian makes, again, a good point, because we have to look into totality. We're looking at just the sub-rate of, I think, 22,000, you mentioned.
That would be $100.
Roughly, the increase. It's 22,000 here. We still have, in order to make this whole thing work, I'm going to need at least three three more custodians, one for each building. That's the minimum. Really need maybe 3.5, based on the time schedule we did. I would like to have LNAs, one in each building, not to go backwards, but it's possible if we can hire the LNA and afford them, we might be able to add more temperature checks. We might, because we'll have a person, maybe we can do that. So it's a total increase. This is just one part of that total that
So,
we're gonna.
so maybe we
Just-
should table
so
this.
Just keep it in mind when it goes to what Jillian was just saying. I don't want to, it's hard because we don't have it all in front of us, but it's all part of a bigger picture.
So maybe we should table this.
Well, again, if I may, Mr. Chair, so $90, and again, that's everybody for 90. I think there's some discussion we should have about certified subs versus not, retention increase versus not. But just taking that number of hours we had in 18-19, and it's $90 versus 75, that's a little under $14,000. I think that's very reasonable. So, I mean, if we did that, we're way better than we are now. If Jim Sullivan were here, he would say we got to resolve the amendment to move on to another amendment, and I think we could do that, which is maybe a $95 rate for certified or retention, treat them the same perhaps, but, you know, we're inching our way closer.
I think it's important that we, again, as Phil mentioned, we want to get the certified person. So certainly, like right now, we got a $10 differential between certified and non-certified. I think we need to end up there, wherever that is, we need to keep that differential. Because we do use non-certified staff, and those folks have been coming in, and if they see the certified folks getting a bump and they don't get one, we might lose the few that we have. So just keep that in mind when you, whatever we set up.
Just another question. So you've got a pool of possible subs, so we need 10 people this morning. We've got 2 lists, one's certified, one's not. Do we pull off here, and if we can't fill the role, then we go to here, or what's the process?
No,
for that?
they can pick the building,
Okay.
we post it, or we use a, what's it called?
Yeah, they literally pick the days that they want to work and what they want to do. We bought software like two,
Subsystem. ASOP. I thought you said face off, I'm sorry.
Yeah.
No, ASOP. She rolls her eyes at me. Just, I'm just like everyone else.
Like Aesop's
No,
fables.
So the subs, to answer your question, when they get listed on ASOP, and then a substitute can pick the assignment. So if the assignments, you know, if I want a sub for you here at Cawley, I put my name in, if I get it, it gets locked in, and then depending on whether I'm certified or not will depend on my rate of pay on the other side.
what do you guys want to do?
I'd like to call the question on the amendment.
So, all those in favor of the amendment?
Yeah.
Can we read?
Can you
So
restate it?
the amendment is to establish a $90 sub rate. I did not differentiate. The class is just 90 across the board.
Was that it, or what happens after 20 days? With the
Nothing.
amendment,
He's talking about his amendment.
that
he
was
made.
just 90 for,
Yeah.
okay.
So you voted up or
So
down?
so we
Ready?
could
Know what I'm
approve it
voting on.
and then roll in another amendment. We could disprove it, roll in another amendment.
Yep. So all those in favor of Wayne's amendment indicate by saying aye.
Aye?
All those opposed?
Nay.
Opposed?
Okay.
Nay.
All right, so start over.
So, all right, I'm
Either
going to
start
make,
over, table it to next week.
The original amendment.
Exactly.
The original motion.
Original motion, which
Right.
is Greg's.
which, geez, now I'm trying to
The
remember.
original
what it
motion was
80 and
80
90, right? Yeah,
$80, and then after 120 days was...
not an hour.
Right, not
Yeah,
an
not
hour.
an hour.
So we either need to figure it out or table it, one or the other.
Can I make an amendment to that?
You can.
Go ahead.
This is
80.
Robert's Rules of Order marathon.
80 a day for a sub, 90 a day for a certified substitute teacher. We don't want to include paras right now.
I want to come back to
That's
it,
fine.
but
So I
for
won't
this,
leave that.
Okay.
I think we need.
And then after 20 consecutive days, I would say like maybe a $10 increase. So that differential
In
is the
both.
same, whether it'd be 90/100.
Do you want it to be
So-
consecutive or just 20 days within the
Cumulative.
district?
Now it's
The increase,
Was after 20 days
yep, after 20 days.
of subbing.
Not
within
consecutive.
Reality.
Not consecutive, within the district.
Okay. So, she needs a second.
I'll
on her
second that
amendment.
one.
Okay. So any discussion on the amendment?
Can I just clarify the amendment?
Go ahead.
So you have it as 80 per day for non-certified, 90 per day for certified after 20 cumulative days? bumped by 10? Okay,
Both of them.
thank you.
So each is bumped by 10. Okay,
What's the 20-day bump, 10?
10
10.
each. So it goes to 90, 100.
Mr.
Right.
Chair, this is the amendment that I wish I had offered.
Okay. Are we done with the amendments? Anybody else want to discuss? Are we good? Okay.
Chair, I'd like to make an amendment, Mr.
All those in favor indicate by saying aye. Aye. All those opposed? All right, so do we have to vote on the original motion now?
So we have an amended motion now, which
Yep.
we need to
Yep.
vote, so.
So we need to take a vote on the amended motion, okay? So all those in favor of the amended motion as mentioned,
As presented.
as presented? Please say aye.
Aye.
Aye. All those opposed? No. Hey, we got something done. All right, so building use of facilities by outside groups.
Yeah, I think we need clarification before we open, and before school starts. You may not want to make it tonight. We're running a little long. But we do need to address the question of what groups we're going to allow in, and then we need to modify our policy on building use, the one we just approved, to reflect whatever guidance you want to give us on that. Again, keep in mind, we are restricting, the only visitors that will really be allowed in the building will be people, for example, if the refrigerator needs to be repaired in the cafeteria. Dean's having problems with the HVAC or something like that. Those are really the only people coming in, other than parents who need to, come and pick up their child. Access to the building during the day will be extremely limited per all the guidance we receive. So with that in mind, what do you want to do when we're not in session? I know we've talked about Boy Scouts, smaller groups, but I don't think we settled on the question of youth basketball or anything where there might be, larger number of kids. Whatever
So-
guidance you would like to give us, we want to include that or be able to convey that to our parents.
So Lindsay, you can go after me. I just want to say real quick. So to me, again, I have stuff in my mind that's 1.0 day one stuff, which is all the stuff we've been dealing with tonight. This is very reminiscent of, I think, a few weeks ago, the first, we got emails and stuff, and people were getting Facebooked or whatever about the 8th grade trip, and we hadn't even really decided what we're doing for school yet. So this, to me, is the same deal. It's like we're really trying to decide the primary things that we're trying to do at school. And to me, this is like a 2.0 or a day two type issue. But again, go ahead, Lindsay. Jillian, I'm sorry.
Well, I just like some clarification, because I totally get where you're coming from with that. But is New Mornings child care that we have at Underhill for Memorial and Underhill students included in this discussion? Because that is
That's-
very important.
That's all part of it.
Okay, so because that will also help people decide if they're doing remote or in-person. That's the lowest cost childcare in our community. And so I feel like people need to know that particular one to be able to make some decisions. I totally agree with the other, those guys need to plan too, and I'd like to get answers sooner than later. But New Mornings to me is a really important one to figure out.
That is something we just talked about last night, and we've talked about it in Candia. They're approaching it the same way that Phil just mentioned, like 2.0. But for New Mornings, they're having it. They're having it, and New Mornings will have to provide us and they have and are in the process of. They will provide us what their plan is, what their protocols are. If there's something we want them to do, we'll tell them. You forgot, I don't know, temperature checks. I don't know how you'd forget that, especially after watching one of our meetings. We talked about it for a lot. But if there's something they're not doing what we want, we're going to be in consultation with them. I would recommend you check that box and say yes, because as Jillian said, our parents do rely on that quite a bit. And it will impact the decision whether it's remote or distance learning.
Greg?
No, I was going to say the same thing, Jillian, you brought it up, but if there's anything that we do need to vote on regarding, outside people using the buildings, that's one we need to do tonight and get that.
I agree.
So, Jillian, I mean,
I'm just,
Lindsay?
I'm just wondering if, because this is all uncharted territory, why we couldn't pull New Morning out of that outside group policy, make a decision on New Morning?
Yeah, absolutely.
And kind of, can we do
I
that?
think
I
that's
think
what-
it is a motion.
I think that's what we're trying
Well,
to
because
do.
I thought I
No, I'm sorry.
understood that it's
No,
all or
I
none.
said it's all part of the discussion.
Oh, I
I
thought it was all
wasn't
part
clear.
of that.
In other words, carve it out, deal with that tonight, and then everything else we can take on later. But because I think
I'm
it is
sorry,
a
I
time.
misunderstood.
I'm sorry, I wasn't clear. It's a time-sensitive question.
Yeah, no, so this is where it comes in that I'm an old timer, my kids are old, and we never did the New Morning, so totally get it, and I think that's a great idea. If someone wants to come up with a motion, we can make it happen.
Like,
So I'd like to make a motion to approve New Mornings Schools to use our facilities, providing the, I guess, support, giving us a COVID-19 draft policy of how they plan on handling that.
A plan, a safety,
COVID-19 plan.
safety plan.
I'll second.
So we have a second, Lindsay? Okay. So, any discussion? No, sounds like everybody's good. So, all those in favor? Aye.
Aye.
Opposed? Nobody. Okay, cool. All right, so moving on, athletics.
We need clarification on this question. I'll let Nat just kind of summarize for you. We received information from Tri-County on what it will look like, and that's Matt's cue to.
So Tri-County is following what the NHIAA is doing, the state athletic organization for high school athletics. And basically what's going on is high school athletics are going to begin September 8th with some competitions beginning September 10th, but most of them starting by September 21st. So what Tri-County has offered, and the sports we have for the fall here at Colley Middle School are boys and girls soccer, our girls field hockey, and cross-country, which is boys and girls. So Tri-County has basically, they've communicated to us, and we're going to follow under the guidelines of the NHIAA of allowing, if we decide, we can decide what sports we want to do, we can decide who we want to play, and if possible, there'll be an open tournament at the end of the season for teams to participate in. So as the home team, we will decide and we will clearly communicate to the visiting school that no one's allowed in the building. We'll have the porta potties outside. Guests aren't able to attend. We'll have the same busing requirements that we have with, what do you call it, the way we get kids to and from school. But it's up to the board on how we want to move forward with this and implementing it. Mr. Middleton's really created a comprehensive plan for all 4 sports. For cross-country, you got to have staggered start times. He created a staggered start time for how you would start the races. You know, different things like sharing water bottles, kids where they were changing, and limiting that. As you know, a lot of the outside sports are going on in the community, soccer, baseball, lacrosse, I think, and those sports are going on, and other places are having other camps in other communities.
Okay.
So,
Matt, none of the sports that we have available have been classified as like, I don't know, the close touchy sports like football, you know what I'm saying? They classified it different?
Thank you. Yeah, there's 3, there's 3, and I can't remember, low, moderate, and
High.
Right.
and high, yes.
Are these all low?
And
Yeah.
cross-country was in low, field hockey and soccer were in the moderate range.
Okay. Lindsay, go ahead.
So did I hear you say that no guests?
So that is, we would make guidelines, and we'd let the visiting schools know that,
As well as our parents.
as well as our parents. But we could say only home parents, you know.
Matt,
develop-
again, that's 5,000 feet, that's up to you guys to decide
Okay,
that.
yep. And then the other thing, there was something else in there too. We'll create our own schedules too. So, and I just hadn't had this conversation with Mr. Rurick and how it went, but obviously, my first consideration, we say, hey, let's, Auburn and Candia, they may not be in our league, but let's schedule a cross-country meet if we did that. Or, so, you know, we would, I talked to Mr. Rurick, and we'd come up with a schedule of what we believed best was teams we want to visit or teams we want to have come to our community.
Lindsay? Go ahead.
Would it be worth, I know we love surveys, would it be worth a survey to parents to see if their child would even play? I mean, is it, because we are going to pay for these coaches.
Tentatively on the survey that is going out tomorrow to pass. It's only tentatively on it right now.
And if you read some of the
If
com-
you're interested in it.
if you read some of the comments, some people are tapped out for surveys. Even though we need this information, you know,
This will be our last
there's
Right.
some- this will be our last one, believe me. It will be our last one. across
Yeah,
the time.
just thinking if, I don't even remember what we pay everybody, but if that's even 3,000, that if you're going to have 5 people show up for soccer.
Well, I mean, so Lindsay, I coached there, right? We always have, you cut kids in all the cut sports every year, and cross-country, just whoever wants to come.
I think what we need, again, 20,000 feet, pick a number, is whether or not the board is willing to say, let's move forward with it based on interest. In other words, yeah, we'll offer it. If we have the kids, we'll do it. If we don't have the kids, we won't do it. So then Matt can send out a survey from him, maybe to his parents, and say, okay, are you interested? Here's what we're offering, please let us know. And then we know whether or not to go forward with it. We just need the overall go-ahead, and then if we can run it, we will, if we have enough interest. I think that's the easiest way to look at it.
Do we know if we have coaches ready to go and interested if we offer it?
Yes, I feel confident that we do.
They
I know
would adhere to
We have
our,
not posted for
we have
it.
not posted any for
We're
it.
waiting for, we don't want to be presumptive and say, yeah, we're going to have it. We need a direction from you folks.
Right.
I would make that motion. I couldn't say it quite as good, to move forward offering fall sports at the direction of the administration. How's that?
If, it will be interest-based. If we have enough
If
students,
interest-based.
We'll run it. If we don't, we can't run it. It's pretty straightforward.
I'll second.
And we're not obligated to pay somebody. Obviously, we don't have the season. We don't get to pay.
So for
Right.
discussion,
No, the only comment I was going to make when you said about parents, so say cross-country can have a large group. That bus could be really full, making it very hard to socially distance. If you're going somewhere, you may need parents to transport. Now the parent is there, they're going to socially distance to watch their child run or compete.
Correct. So that was in Mr. Middleton's plan about cross-country. He said that the number of participants for each meet, if we went to visit, would be what we could maintain with the bus. So we would just assign kids, almost like we do with golf. You're going to this meet, you're going to this meet, and that's the way we do it.
Anybody else?
The only comment I'll make, I'm sorry, go ahead, Wayne.
Oh, no, just to speak to my second, I like the idea. I think it's essential. The only part that I wrestle with this is we just had a discussion 2 hours ago about someone picks up a symptom and has a test and we're shutting down school for 5 days. And so, although I think this is critical in my head, it's a risk factor. So I suspect many other people have that same dilemma.
I guess the comment that I'll make is, you know, I know from my own personal perspective is my son's been in camp all summer long. There's been no issues, and I think we need to try to give the kids some sort of normalcy as best as we can to get them back to that interaction and out on the field and doing things. So I would support it.
And they're all outdoor sports. So-
And again, this would also be open to any child that, if the parents would like, if they choose distance learning, they can also participate. It's not just for in-person students.
Yeah, I mean, that's the same as kids at a homeschool, right? They have the ability to play sports here.
Well, homeschool's different.
Yeah, but we have a homeschool.
Okay,
Maybe Rhode Island.
in Rhode Island, in
Yeah.
a crazy little state,
No, no.
that's a no-fly zone.
No, I know. Yeah.
So one of the few things they're clear on.
Yeah. All right, so any more discussion on this? No? So, okay, so we had a motion and a second, right? So, all those in favor?
Aye.
Opposed? Good.
And before you conclude, I texted you. Can we, I
Oh,
would
that's
like
right.
to hire the computer teacher. I know we did a poll vote.
Yep.
But I would like a motion to hire Andrea Meyer as our computer science, computer teacher.
I'll make that motion to hire Andrea Meyer as the computer teacher in the Hooksett School District.
Okay, all those in favor?
Aye.
Aye.
Opposed? All right, so we have no public, they all left. We don't need a non-public, do we? We need a non-public? No, me neither.
But you do need a motion to adjourn.
Can, yeah,
Oh,
We need to pick a meeting date.
yeah.
We have
He wrote it big on my agenda.
the 18th.
Are we good for the 18th or no?
I would prefer we push it back a little farther, because the 18th is just next week.
So the
Right.
25th?
I would like to do it on the 25th, because I'm not sure we'll have that scheduling done. So I would be more conservative and say,
Could we do 6?
or whatever. the following.
go ahead, Lindsay.
Yeah, no, I was going to mention the 6 o'clock. Also, if we move it to the 25th, if any calendar changes come up, will you guys get that? to the
Should know by
parents?
then,
How-
I don't-
How does that work? If we have to approve it, but because that's just before the start of school.
So we're scheduled for the 18th, which is next Tuesday. The 25th will be the following Tuesday, we're already into our second day of teacher training. Again, the answer would be, we have to, yes, the board would have to vote on it, so.
Here's an idea. What if we needed one, couldn't we, if it's posted in plenty of time, do a remote?
Poll vote, you mean?
She's concerned that if we wait till the 25th to make a decision to extend the start of the school year, is that enough time to notify
Why don't
families?
we do the 18th or remote, just to deal with that?
If you think, do you feel like a week would be enough time for you
Yeah,
to
with that
know?
we could answer.
Okay.
I'm pretty sure we can answer. It might not be done, but we should be able to.
So we a quick Zoom on the 18th, you mean? Is that what's going to happen?
Would we, or could we do it by email?
Poll vote?
Or
I think
either
it's
way?
better to talk about it.
Okay,
I think we should, there's just, it might be a 2-minute conversation.
yeah,
but-
that's fine.
And then maybe something else comes up.
Yep, okay, as long as notified, public's notified, et cetera.
Also, we can also do the parent question. on the-
Have the info.
are meeting on the 18th, sorry.
Yes, I mean, yeah, that's a good idea.
Oh.
Excuse me,
At what time, 5 or 6?
whatever works for you guys.
6.
6?
6.
Whatever, that's fine.
Yep.
Whatever's good.
If it's going to be a 2-minute meeting, well, you included the para thing, so the 2-minute meeting's just gone now.
Well, first of all, we'll have Amy there, so she's no nonsense, so believe me, it's not gonna be a long conversation.
No, that's fine.
Are we going to be talking about the custodians too then?
Yeah, we're gonna need to sign off on that, I'll have a class for it.
Okay.
And
So-
the Ellen,
The 18th and the 25th at 6 o'clock.
yes. 18th would be a Zoom.
Okay,
Perfect.
Wayne, you okay?
We're trying to adjourn. I just wanted a closing comment, it's been interesting to look at what Hooksett has done and look at other towns, and I'm really happy and proud to be in Hooksett because we're doing a good job. So Karen and I can differ on masks, and Lindsay and I can differ on temperatures, but we've talked about getting the big stuff right, and I think we got the big stuff right, so.
Yep.
Not to do this, but I feel like we did a pretty good job, so.
Yep, good.
Just had to say that.
Yep, excellent. No, it's always good to have everybody moving in the same direction, even if they're not, but at the end of the day, my deal is we've always been here like this. It's like, we can disagree here, you make your votes, and you leave, and it is what it is, right? There's
No
no
hard feelings.
going out in town and going on Facebook and pounding somebody or whatever. It's just, we call it done.
I agree, I've been doing this a long time, and, at the end of the day, it's what the board wants, and we move forward. It's like, okay, we stated our case, If the board doesn't agree with something, my position is, okay, move on.
But we had excellent material, so thank you all for that.
No, like I say, the thing that's readily evident was how much work was put into this for the whole last 6 to 7 months worth. So, and again, nothing's perfect, but you guys are doing a great job, and we're very lucky. Motion to adjourn?
Motion to adjourn?
I'll second.
Hey, we got there.
All in favor? Aye.
Thank you, everyone.